Okay, we're going to start off with the first section. First section on the cat then is the head and neck, and so we want to hit the head and neck first. What I want to do is I'm pulling the head back so that I can actually see these. This is the site of injection, so where they inject them with latex, and that's where they make their first cuts. So what they did is they actually pulled this muscle wall apart and this muscle wall apart. These two muscular walls that I'm pulling, these are actually called the sternomastoideus. Now the sternomastoideus, there are actually three of them that come up. They all come up from the sternum. So sternomastoideus actually goes up, and it goes up to this muscle called the masseter up here. It's a big shiny white one. It's like that cheek muscle. So when you grit your teeth, you can really flex. Then there's two more sternals that come up from the sternum. There's right down the middle, there's the sternohyoideus. There's two of them, and there is a slight line of separation between them, although it's hard to tell because they've kind of scooted them over. And then there's another one right here, and there's a line of separation there, and it's this one to the side. That's my sternothyroideus. So there's a sternothyroideus on the sides. There's one over here as well, and there's two nice thick ones on here, sternohyoideus. It is on this cat hard to see the separation line. Sometimes it's easier. By the mandible, by the bone right here, I can actually feel the bone, and there's a digastrocus here on one side, and by the other mandible bone, there's another digastrocus. So we have five total: sternomastoideus, sternohyoideus, sternothyroideus to the side. Digastrocus would be the ones by the mandibles, and then really clear is that cheek muscle called the masseter. That's the head and neck. We're going to do the chest, neck next. With the chest, we're going to start off at the top, and these lines aren't perfect, but they're not bad. What we can see on the top here is we can see what's called the pecto antebrachialis. Pecto means it's like a pec muscle. It's going across the chest. Brachialis, or brachial, means it's going to be going into the arm. So this one actually extends across the chest and then towards the arm. Right below the pecto antebrachialis, we have the pectoralis major. It goes here and here, and they've cut this line in pretty clearly so that I can see the actual section. It's a little bit beat up and cut up because when they first got the skin off, they probably hit the muscles. Below the pectoralis major, going from here to here, is the pectoralis minor. Goes from here to here. And below the pectoralis minor is called the xiphi humerales. The xiphi humerales starts with an X, and you can actually feel the xiphoid process that we did in our last unit right there. And the xiphi humerales comes right down to that xiphoid process. Underneath the pectoralis minor, if I would scoot it aside and get under there, you actually have what's called the serratus ventralis. I can feel those muscles on the bones there, and they actually go up and down like a serrated knife would. So now we're going to do the arm. The arm has 11 total muscles that we're supposed to cover. What they did is when they pulled off the skin and they were skinning it, one of the things that we said is, hey, you've got to save this muscle right here. So they carefully pulled the skin back and got to this point, and then we could see all the muscles here. And then there was a lot of fascia tissue on here, and that fascia tissue, you can kind of see we removed it back a little ways, but it's still fairly thick. It's this white stuff. At the top, this is not a muscle right here, but this is my first muscle, and that's the one they saved really well. We're going to count our way down, and this is my extensor side with all the extensor muscles. They're called extensors because when they flex, when they shorten, they actually extend the paw. So we have 5 extensors. We're going to work our way down from the top, and we're just going to count them out: 1, 2, 3, 4, 5, and then we're going to get to the ulna, and we're going to name them. So I'm starting on what's called the radius side, so I'm going to start off with what's called the brachioradialis. That's this first muscle. The second muscle is going to be my extensor radialis longus. It's number 2. Number 3, in the middle of the 5, so I think of it as in the middle of the community, is the extensor digitorum communis. Number 4, if I work my way laterally 1, I get to the extensor digitorum lateralis. And then my 5th one right here, and there's a line of separation, and it's actually, on most cats, it's a little bit darker. And then I hit my ulna. This 5th one is the extensor carpi, named after the ulna ulnaris. So extensor carpi ulnaris, that's number 5, right next to the ulna. If I flip my cat over, I'm going to stay on that ulna side. I'm going to find that ulna again right there, but now I'm on the flexor side. This is actually the side of the palm or the paw. So when I look at this side, right away next to the ulna on this side, I have what's called a flexor carpi ulnaris. Again, right next to the ulna. If I work my way over, there's a big, huge one, and we had to take off all this fascia tissue to see it, but the cuts are right here and here. That one leads down to my palm. It's called the palmaris longus. There are a couple more arm muscles that we need to get down. We've done 7. There's a muscle right here. It's really a thin flap. It's only found on cats. It's not in humans. Most of them are in humans. And this flap is called the epitrochlearis. On one arm I'm going to save it, but on the other arm I would actually cut it free, and I would get under that thin muscle, and I've kind of started it already. I'd get under the fascia tissue, and I would want to cut that free so I could pull that back. By pulling it back, I can actually pull up this clavobrachialis here, and I can see this shiny one right here, and that's my biceps brachii. You're not going to see that on any diagrams, and the only way to get to it is to remove these muscles to see it. Epitrochlearis, this is the flap. Biceps brachii, which is what we have in humans, and we'd see that right away. We have two more muscles on the arm that we need to get to. That would be the triceps longus and lateralis, and I'm not sure how clear this is, but there is a white line of separation here that kind of shows it. I can kind of feel it separates as well, but that would be right here. Going up to the elbow would be my triceps longus, and this other one right here would be my triceps lateralis. We're going to check the other arm and see if it's cut in, and you can see they did cut this in, and it makes it a little bit easier to see, and it's really nice separation. Triceps longus, triceps lateralis right here. That would be the arm. All right, we're doing the leg next. With the leg we have, it's like 20 or 21. It's a lot of muscles. So we will work our way through. We're gonna start off, and you can see the legs, they're really muscular. Tons of muscles here. And what we're starting off with is we're starting off with some thin ones here. This one right here, the lower portion, and it actually separates right here. You can kind of see it. But this is my gracilis muscle. And on this side, they actually separated that gracilis and flipped it back. And then this other one on top of it is my other us muscle. It's called the sartorius. And they have that one. They can flip that one back as well. They had to very carefully get under that muscle, separate it, cut it away from the knee, and then they pulled it back so that we could see the muscles that are underneath. That's the only way we're going to see the muscles underneath. Now, using my diagram, I'm going to work my way up the muscles underneath. I'm going to start at the bottom, and I'm going to work my way towards the top. If I start at the very bottom, I have two muscles that are called my semi-muscles. This one is my semi-tendinosus. Right next to it, or right above it, is my semi-membranosus. Above that are my two adductor muscles. They have an adductor femoris right here, and there's a change of color, and we end up getting my adductor longus. And I think that's their separation line, but it's kind of hard to see. So my adductor femoris, then my adductor longus right above it. And the adductor longus ends up being darker and longer and thinner. The last one above it, and I'm hoping we can find it, and it looks like it's there, is that pectineus right down in there, and it's a small little muscle. Some people say the puny pectineus, but it's kind of hidden underneath the veins. Some people have shredded it when they pull back the gracilis, but this one seems to be fairly clear. After I do that, I'm going to go up to my quads, which would be this upper part. We talk about quads being on top of our thigh. Cats have quads just like we do. 3 of the quads are going to start with the term vastus, and one of the quads is going to be a little bit different, so we're going to work our way through. This first muscle here, which is towards the middle, is the vastus medialis. Vastus muscle, like I said, but it's also towards the middle, so it's vastus medialis. Then we're going to do the vastus lateralis, which isn't totally uncovered here, but if I pull this fascia tissue back, I can see it's right here, and it comes around the side, so I can see it there. That's my vastus lateralis. Right in between, this is usually a much shinier muscle than it is on theirs, but I can still see it really clear. That's my rectus femoris. It runs right in between the vastus lateralis and vastus medialis. If I tuck in between and I pull that vastus medialis back, and I look in there, I can see a line of separation. I can actually see another muscle down in there called my vastus intermedius. That's down underneath. That would be my last one. So vastus medialis, rectus femoris, vastus lateralis, and going in between the vastus medialis and rectus femoris is the vastus intermedius. Now I'm going to flip, and I'm going to go over to the side of the leg, and we're going to look for the one that they pulled back. This is the back side of the leg. It looks like this to begin. We're going to take that biceps femoris. Again, if I hear the word femur, by now I'm starting to think, okay, that's going to go across the femur. This is my biceps femoris. I pull that back, and when I pull that back, these are the muscles from the other side, so I don't have to do those again, but I want to cover the biceps femoris. Then right next to it is this one here. Caudal means tail, and this one actually, if I followed it down, would go to the base of the tail. But this is called the caudofemoralis. It goes towards the tail. It also has the word femur in it. Caudofemoralis. If I go above the caudofemoralis, they actually have what's called their gluteus maximus would be first, and it looks like it's right in here. gluteus maximus, and their gluteus medius would be right above it. They don't exactly have cut lines in it, and it's not crystal clear, but it looks like this is their maximus and this is their medius above it. On humans, the maximus would be larger and the medius smaller, but not on cats. They also did a really nice job with what's called the tensor fasciae latae. That's the muscle part of it, but they kept all that fascia tissue as well. So I can get underneath and I can see that muscle's really clear, and here's the fascia part. So tensor fasciae latae with all that fascia tissue. The last part that I need to do on the legs is I need to go down to the calf. The calf, we actually have what's called the gastrocnemius. That's my huge calf muscle. My calf muscle's right there, and if I pull that back, I should have been able to see very clearly a soleus muscle. And you can see that muscle's right here. It's a little bit darker, but it's right there. That soleus, I always say it goes down to the sole of your feet. That might be a way to remember it. This is my gastrocnemius, and right by the tibia here, and you can see the tibia's right there, there's a tibialis anterior. It's anterior and it's by the tibia. The last thing that we need to cover is that gastrocnemius, and they don't have it uncovered yet. You're going to have to. There's an Achilles tendon that attaches the gastrocnemius to the calcaneus of the cat. We're going to do the abdomen next. What we did is we got our finger underneath right here, and we actually pulled this up, and this was my external oblique. It's called an external oblique because the grains of it run like on our x-ray lab. They run oblique. They run diagonally. If I got that up, and they actually did, once I got that up and it's really clear on theirs, these grains run across it, which are transverse. So this is my transverse abdominis. Transverse abdominis runs until I hit this section here. And on this section, I can see the grains again start running at a diagonal. I can see them underneath. So I have these diagonal grains. That's my internal oblique. My internal oblique actually runs, sorry, now you can see the internal oblique better. The internal oblique runs like this, and you can see the diagonal grains on it, and it runs till I hit this rectus abdominis. And the rectus abdominis, the grains aren't transverse, they're not at a diagonal, but the grains actually run the length of the cat. So you can see those, and they run all the way up down the middle. Theirs showed up really well. Most cats, it's really hard to see those rectus abdominis muscles. We had the triceps lateralis and the triceps longus before. Those were part of the arm. Now we're going to do the shoulder. Like with every section, we want to make sure that we're trying to find a point of reference. So our point of reference here, I'm going to look for this one right above the triceps. It looks like a football. It's the spinal deltoid. So deltoid is a shoulder muscle. We're going to look at the spinal deltoid here. And then they cut it in, but you can see this triangular shaped one right next to it. That's my acromial deltoid. So they have a spinal deltoid, acromial deltoid right here. If I look up here, there's actually one that goes up towards the shoulder, towards the clavicle. That's called my clavobrachialis. Clavicle would be here, and this is headed up right towards it. At the clavicle, there's actually a white line that would separate, and it becomes the claviotrapezius up towards the neck. So claviobrachialis, claviotrapezius. There's also two other trapezius ones, and the trapezius are really of the back. So we have clavotrapezius at the top. We have acromiotrapezius, which runs from here to here. And then we have spinotrapezius, which runs from here over here. Acromiodeltoid, spinal deltoid, acromiotrapezius, spinotrapezius, clavobrachialis, clavotrapezius. And then we have one left we haven't touched on yet, and it's right here. It's right in the middle of them, and it's kind of rectangular. This is, and it's right on the top of the scapula. It's the levator scapulae ventralis. It kind of levitates over the top of the scapula. That's the last one, the shoulder. One that's not mentioned in this area, at least in the diagram, is right below this spinal deltoid, right below this muscle. And this is a huge one, and it makes a V back right here on your back, but that's my latissimus dorsi, and it's huge. Some students have kept it, some have kind of had it fall off as they pulled the tissue off of it. On the other side, we're actually going to pull all of this muscle off, and we're going to look at what's underneath it. And I can feel there's a spine right here. That's what I'm going to look for on my other side. So on this side, I'm actually going to pull back the muscle so that I can see the scapula bone right here. I can move it. That's my shoulder joint. And I found a spine right in here. Superior of the spine, we have a muscle right here called the supraspinatus. Inferior to this spine, we have a muscle that goes down to here, and that muscle is called the infraspinatus. Now there are two other muscles here. One goes towards the armpit. It starts here, and it comes right here, and it goes towards the armpit. I always say hairy armpit or teres armpit. This is my teres major. So my teres major is on this side. Wrapping around the other way towards the middle or the medial would be my rhomboideus. And you can see that rhomboideus wraps around and starts at the same spot. That would be all the muscles on the cat.